Hi everyone, Namaste, Dr.Jyotsna here. So I will be talking about seldinger technique and I will be explaining how to put SD catheter or that is hemodialysis catheter or central line. So it can be placed in internal jugular, subclavian or femoral area. So whatever is the best access we put. If we are putting SD catheter, there is a chances of stenosis in subclavian vein more. So we have to see if we are not getting other vein, then we can put it on subclavian line also. So let's start with the equipments. Basically, I will be talking about the equipment part only, and maybe some other video I will be talking about the surface landmark. So let's talk about the equipments, how to do and what are those equipments. So you can see here clearly. So this is needle, 14 gauge needle. You can see it has a hub. This it has a syringe. It has a hole through which this guiding wire can be placed. So this is a seldinger technique J-tip guiding wire. So you just see this. The time I slide it, it got bent to J-tip. So the main purpose of this J-tip guide wire is that it doesn't damage the structure, because of its like it get full, it doesn't damage the structure which it is touching. It doesn't go to the posterior wall or and it doesn't invade that wall. So that is, and there is one to make a neck if required. Dilate through this guide wire, dilate it, and then this is the triple lumen SD catheter. Same way, this is the SD catheter will be the diameter will be more. So if it is central line, the diameter will be smaller, and this is a 3 triple lumen SD catheter, and this is the central port from where the guide wire will come out. Okay, so let's see how we do it. So this is the needle and this is the syringe which we have filled with some NS. So suppose this is the area where we are piercing. So we have pierced it with a bevel up. So we will pierce and gone inside, and now we have to, while going inside, always while going inside, when you are going inside, suppose we have started, gone inside, while going inside you have to keep on aspirating. So once you get the blood, so that is the place where we have to hold. So now holding will be like this. So this hypothenor area should be touching the patient's body, this thing, and this should be you have to hold like this. So now, so that this doesn't move, so you have to fix this part to the body like this. This is the body, so you have to put like this part should be like this, and by this you have to be holding like this. Okay, so this part like this, and this by these two you have to hold the needle, and then disengage. If you require, you disengage it, or if there is a hole in all you will not get this hole. In some kit you will not get this hole. In that condition you will have to disengage it, and then you have to put this J-tip guide wire through this. So see, this way you have to do. So once you have gone inside, now you have to take this out. So now you are inside. Okay, so now you have to put the dilator. So while going inside, like you have to do it, you have to go in twisting. And see, one thing is very important. While you are going inside now, be sure that when you are going inside to follow the guide wire direction. Don't make it like this. Don't do like this. Don't do like this, like that. So it will get bent and it will go away from the vessel. It may erode the posterior vessel. So you have to vessel wall. So you have to follow the guide wire angle. So just follow the guide wire angle and in twisting motion. Once you have gone a little bit down, then check it is free. So it is free. Then go further down. Then check it is free. So go further down. You just have to make the track over the skin and muscles. So once you have gone, then take this out. And before using this, please check all the lumen are okay. Just flush it and check it. Now you have to use this. It's very easy. So this you have to keep this open. I have to open it. So from here, so now you have gone inside. So just keep this closed. Otherwise, from here also blood will come. Now take this out. So now you have taken this out. You have to just like this, and you have to check it. The air is coming because I am not doing it in the patient. So here you will get blood. So blood has come. Now you have to flush it. So all 3 lumen you have to check and secure it with suture. Thank you.